Well, for the first time in 15 years, the American Academy of Pediatrics updated its childhood obesity guidelines. They now say doctors should offer drugs to obese kids who are 12 and older, where appropriate. Surgery should also be considered for teens 13 and older with severe obesity.
Yeah, this actually has the potential to impact millions of children. So joining us now to talk about this issue is Dr. Sarah Hempel, a lead author on the new guidelines. Thank you for joining us.
Thanks for inviting me.
All right, so doctor, first tell us, why did you decide to make these recommendations?
So I think it's important to realize that these recommendations were made by a team of individuals who did a careful literature review about what the best available evidence is for a number of different treatment options for children and teens. The foundation of what we consider the foundation of treatment is family-based. It's called intensive health, behavior, and lifestyle treatment. And it's recognizing the strengths of the family as well as the challenges that families face in living lives that are healthy today. And so before, yes, medications and surgery are also evidence-based options, but the foundation for treatment is really intensive health, behavior, and lifestyle treatment. And that's something that you can talk with your child's pediatrician or other pediatric healthcare professional about.
You know, it's interesting because we talk about children, and children, they are, 12-year-olds are still growing, 13-year-olds are still growing. We're talking about surgery for 13-year-olds plus, medications for 12-year-olds plus. Is there any negative impact on, the growth of these children if they're going through, having either medical intervention or a surgical intervention?
So part of being part of a comprehensive treatment program is taking those factors into account, recognizing that kids are still growing, and also recognizing, unfortunately, that most kids are not outgrowing their extra weight, and they're developing complications right now in childhood that can affect them for a lifetime, medical and emotional health consequences. So we believe that a thorough evaluation of the child is very important, and also in offering these evidence-based treatments, we're paying attention as healthcare professionals to not only the benefits to the family and the child, but also any risks that are associated. So there's a lot of consideration and careful monitoring that goes on before any treatment recommendation is made, and it's always made in conjunction with the family.
Okay, speaking of the family, doctor, what is considered obese for a child, and does it vary depending on a child's background and heredity?
So what is considered obesity, and again, I want to just say that's not necessarily the term that we talk with families about. We really talk about it in terms that are more family and child friendly, such as extra weight, or even talking about the consequences or the things that we're worried about as healthcare professionals. But it means that a child's body mass index percentile for their age and sex is above the 95th percentile. Again, that's not the only factor that has to do with a child's health, but it is an indicator that further evaluation needs to be done.
It's interesting just that, you talk about the terms you use to talk about weight, which is interesting because, I remember growing up and, somebody was big boned, or somebody was, like there are all these sort of terms, like what is the right way to talk about this stuff with your child? Because what you don't want to do, and what has happened, I know, for generations, is that, parents are hard on their kids for having extra weight, as you might say, and then they take that, they internalize that, and then the results of that follow them for a lifetime because they feel like, they feel like less than because of what they heard from their own parents or from their doctors or their classmates. So how do you sort of bridge that gap?
Great question. So there are a number of different resources for parents and providers, healthcare professionals, to know how to sensitively, in a non-stigmatizing way, talk about extra weight. And it really is, again, in terms of the child's health. So we recommend certain ways of phrasing and talking and being sensitive and showing love as a parent to your child, letting them know that you want to work with them as their parent and as a family to make healthy changes that are going to help them get to a healthier weight. So yes, there are a lot of tools now, both from the American Academy of Pediatrics and other national organizations that help parents know the best and most sensitive ways to bring this issue up with their child.
So, doctor, what are some of the health issues that a child could face in adulthood or even in childhood if this issue isn't addressed?
So high blood pressure, diabetes, prediabetes, liver disease, sleep apnea, as well as a number of emotional health issues as well. Bullying and teasing are right up there as some of the most common that kids with obesity suffer. So really from head to toe, there can be health consequences, and part of treatment for these consequences really involves treating the extra weight itself, because a lot of times that treatment can also treat these complications or even perhaps reverse them.
All right, Dr. Hampel, thank you so much for the time today. We appreciate the
Thank you.
insights.